Today I wanted to show you a common question we have with the Infrex unit, which is completely justifiable. The main thing we want people to understand when they're using interferential mode, not so with the TENS mode, it's not that important, but when you're using interferential mode, always use the AC adapter that plugs into the top of the unit whenever you can. There's a simple reason. There's more electricity that we can pull out of that wire than we can pull out of rechargeable batteries. But what I did want to show you, patients will say, well, why do we have a rechargeable battery system? Because basically in this unit, again, due to the amount of energy that's being used, we usually use the AC adapter. And that's what we want to use when we can doing interferential mode. But there are times when you will need to use the rechargeable battery system. Those times, what I wanted to show you is you may have a unit, and this would be especially true in situations where you just don't have the ability to plug in. Where we see this often is in the military. You may have people that have been deployed, they've been working 22 hours, they're trying to get to sleep, they may have had some type of minor injury, or they may be having trouble going to sleep, and they don't have a way, and you're trying to keep the people up and moving and doing well. In those situations, they can literally take the Infrex unit, use the rechargeable batteries, and actually take the treatment right there, either in the battlefield, or for those of us that aren't in the battlefield, and thank you, United States military, for what you do, those of us that are getting in the car, or we're getting ready to go shopping, and we don't, or flying an airplane, and we don't have the ability to plug in, that's when you go to this battery system. And basically the Infrex unit will last on interferential mode for approximately 80 minutes before you have to recharge the batteries. But that is one of the reasons we have a rechargeable battery system, is to actually make this where it can be transported and used as needed. Now, when you're not using it, you can have your batteries plugged in and be recharging for the next set, or carry several sets of batteries. One of the reasons we designed the unit as we did is you may be able to see this little curvature. That was to make it so that, example, you did have somebody in the field and they needed to have their unit, it can literally be strapped onto their body. And they can actually, because of the curvature, wear it without it causing any other problems. Now, this is what we sort of call a portable first aid. And it's awful nice to have a patient or a soldier or a sailor to actually have the unit with them and be able to use it when needed, as needed. Now remember, even when you're working, even when you're trying to sleep all night, there is nothing wrong with wearing the unit and having it run constantly if that helps you get rid of your pain, or if that also helps you sleep. That's just another way to use the unit. But I did want to show you that, the purpose behind the rechargeable battery system versus using the AC adapter. Closing comment, anytime on interferential mode, when possible, use it with the AC adapter. But in case you can't do that, go to the rechargeable battery system. And remember, when you're using it with the AC adapter, take your batteries out. You do not want them in the unit when you're doing that. Thanks for watching.